More hospital services will be allowed to resume as some circuit breaker measures ease on Tuesday. Cheryl Goh finds out how doctors are gearing up to see more patients with chronic conditions such as diabetes and high blood pressure, even as they get used to new ways of working while the fight against COVID-19 continues.
We do hope that we'll be able to, for example, take in new referrals so that their care, which may have been deferred from 2, 3, 4 months ago, they will be able to be seen in a timely manner. We will be able to see more patients, for example, for their podiatry care. Certainly, the wound inspections and wound dressings need to be needed. That will continue. And we certainly hope to be able to slowly increase the number of on-site visits where needed, but also to encourage our patients to continue with teleconsultations, as that's going to be safer for everybody.
Our clinicians will be doing background checks and carefully prioritize which consultations and procedures need to be attended to first, bearing in mind the patient's overall well-being at the center of our decision-making. We will also continue with some initiatives that we have put in place during the circuit breaker, such as teleconsultations, home delivery of medications, and also community care services.
We want everybody to be safe. If they are a little bit concerned about returning to hospital, again, we are very happy to offer them alternative models of care, whether it is a phone call, whether it's a video consultation, sending their medications to them. At the same time, we also want to be sure that there's safe distancing when they come to the hospital. So we may have to space out some appointments. The other measure that we've also taken is for patients who do require on-site in-person care. As a department, we have worked to try and reduce the time that they spend in the clinic or on-site in the hospital. So our patients are able to actually register from home to indicate that they're coming for the appointment. And when they come after they register and do the contact tracing apps, they actually just come in for the consultation, and they're actually able to leave immediately after that. Because we will do the medication delivery to them as a free courier service.
The backlog will be, over a couple of months. It will not be able to be cleared so quickly. But we need to do this in a very gradual fashion and very calibrated fashion so that we are still able to remain versatile and react. So if there's a resurgence of COVID cases, then that gives us the opportunity to switch back into a mode where we can deal with the COVID surge a little bit better. But at the same time, we have to take into consideration that patients are waiting quite long for their procedures already. I think we have to get used to a new norm, So we have to, always be ready to deal with this COVID cases and be ready to deal with any surges, right? But at the same time, the work that we do in terms of taking care of patients will have to continue. So the way that we make our clinical decision will then be a little bit different from what it used to be before. So it has to take into consideration available resources and the possibilities of certain changes that we need to react to very quickly.
Now, for more insights, we're joined by Dr. Leong Ho Nam from the Rofi Clinic at Mount Elizabeth Novena Specialist Centre. And Dr. Leong, now we know that your clinic specialises in infectious diseases, vaccinations, wound and stoma care. So how is your clinic prepping for phase 1 post-circuit breaker? What kind of challenges are you seeing?
Now, thankfully, my clinic is one of the essential services, and infectious diseases infections still happen, and indeed COVID-19 is one of them. Now, we're going to see a lot more patients who are coming back to us who had delayed follow-ups. So we have been sending medications to them. We're anticipating more and more patients come back instead of a shorter follow-up that which they had early on, they're having longer follow-ups. Number two, we're going to talk about vaccinations. Patients are coming back for vaccinations, which they couldn't do for the last couple of months. Then we have got patients who are actually on chronic illnesses on follow-up with us. Now they can come back for their regular checkups instead of just collecting for the medications. So in our own clinic, we have to space out places where people can sit. We have to space out the timings so they don't have too many patients and too many patients group coming into the clinic at the same time.
Dr. Leong, what's critical for healthcare institutions then to look out for in order to cope with the resumption of certain procedures?
I think this is a challenging time. If you think about it, it's a new normal where the war is still ongoing. This is the virus which is attacking us. At the same time, we still have our peacetime efforts. We have to look after our usual complications, the knee replacements that have been done, the surgeries, etc. Even cancer surgeries have to be done. Which means in one arm, you have to be ready to fight the enemy, and the other arm, you have to carry on doing your usual work. In the old days, it would be one sword or one spear, and then a farming tool on the other. So we have to maintain this ongoing until the virus is controlled or until we have a vaccine. What it means in a hospital is that patients with elective surgeries or elective admissions come into the hospital. We need to be mindful that they may be Trojan horses, they may be carrying the virus and in turn spread on to the other people. We also need to be mindful that the visitors who come and visit, the relatives who visit, may spread the infections, and then patients who are clean, that means they're uninfected, versus patients that are infected individuals must be separated and clear paths such that they do not cross over each other. These are challenging times, and at the end of the day, it is good infection control. Good infection control that's not just practiced by healthcare workers that's important, but practiced by everyone who visits the hospital. In fact, every Singaporean out there needs to have good infection control. In terms of the hospitals, they also need now, they have spare capacity because they cut off a lot of elective surgeries. But when cases resume, they must always have the spare bit to cope for the sudden spurge in cases from super spreading events that could happen anytime. Remember, there is always another wave that's threatening on our doors at any time, any day.
Yeah, good to be mindful of that. Thank you so much this evening, Dr. Leong Ho Nam from the Rofi Clinic at Mount Elizabeth Novena Specialist Centre.